Hi, everyone. Welcome back. I'm Samantha, the maternity mentor, and welcome to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is our chance to interact with you guys and answer your questions live. So if you guys have any questions, please feel free to put them into the chat below. Remember to share this channel with your friends and family. Follow us over on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Also remember, please like and subscribe to the channel and hit that notification button to get notified on our latest content. We have some really exciting videos coming up for you that I'll tell you about towards the end of the live stream. And again, if you have any questions at all, please feel free to put them into the chat and we're going to get started. Hey, good evening, Z. Welcome back. Thank you for joining us again. So I have a lot of questions this week on bleeding. So in between answering any questions that you guys have, I'm going to try to address some bleeding concerns. Bleeding is a very big topic that you guys oftentimes have questions on. One of the first questions we got is, were you bleeding before you found out you were pregnant? So a lot of people will actually bleed before they get pregnant. Remember that a lot of women don't know they're pregnant until they're 6, even 8 weeks pregnant. You know, even if we're planning or trying to get pregnant, it doesn't always mean that we realize or test to see if we're pregnant. And there's some really common causes of bleeding during the first trimester, especially during that first 4 weeks, that we'll see bleeding that's completely normal. For example, you can get your period. So your normal menstrual cycle can happen even though you might be pregnant. So if you're trying to get pregnant, but you're not actually taking a pregnancy test until you miss a period, you could actually be 3 weeks pregnant, have a menstrual cycle, and then not know you're pregnant until the following month. So that's one really good example of where you might be bleeding before you are actually knowing that you are pregnant. One of the reasons why this is really important is if you guys think that you are going to try to have a baby, if you're actively trying to get pregnant, you should avoid certain things, like you should avoid drugs, you should avoid alcohol, you should avoid smoking tobacco, because these things are all not good for your growing baby. And you want to make sure that you're very healthy going into this. The other thing is, any woman of childbearing age, even if you're using birth control, should be taking a prenatal vitamin. So we take for granted that because we might be using birth control, that means we're not going to get pregnant. But birth control is not exact. In fact, there's like a 1% chance risk, even using it correctly, that you might get pregnant. So it's very important that you are extremely healthy when this happens, and that's using a prenatal vitamin. So, yes, you can be bleeding before you find out you're pregnant. Now, the next question was, I conceived through IVF. However, my report said I was positive for pregnancy after 20 days of missing my period. Today I have brown spotting. Is it dangerous? So this is an interesting question. So brown is old blood. This is a sign that there was bleeding somewhere and now it has resolved. In this case, this is a patient or a mom who's had IVF. IVF is in vitro fertilization. It's usually where the egg and the sperm are fertilized outside of the womb and then they're implanted into the mother. So when this happens, we know the exact date a mom gets pregnant because we know when she had the implantation. Now, once that happens, usually the pregnancy will either progress normally or, you might end up unfortunately miscarrying the baby. We oftentimes don't see that brown, but what you got to understand is IVF is a medical procedure. This means there is some manipulation, including manipulation of the cervix. So when the cervix is manipulated with an instrument like that, like even for our regular pelvic exams, when we get swabbed and stuff, you can have spotting. And so in this case, that brown bleeding may actually be old blood from the procedure and may have nothing to do with the pregnancy, and the pregnancy might be healthy. Now, this highlights one of the biggest things. If you see any type of bleeding whatsoever, you want to make sure that you contact your healthcare provider so they can assess you. Last month, I didn't have a period, but this month I could experience redness and pinkish to brown discharge. What could that mean? All those colors are a sign of bleeding. This is a sign that something is going on. So a pinkish color can be spotting, and spotting can happen for a variety of reasons, including rough sex, sexually transmitted diseases, even a yeast infection. So again, pink is more of a going into an active bleed, but it's a very, very, very tiny amount. So usually we're not too worried about it. It's bright red and dark red that's our biggest concern, because that's the sign of an active bleed that's going on. And those are the most concerning, especially early in pregnancy. So I have another question. I'm 5 to 6 weeks pregnant, and I started experiencing spotting 3.5 days ago. It started as spotting, so I went and had blood work done and a pelvic exam. I haven't heard back from the doctor, but since my pelvic exam, the bleeding has become more red than brown. Not going into my underwear, only when I use the restroom. This is my first pregnancy, and we've tried a while for this little miracle. I guess I'm just looking for anything that could ease my nerves and let me know that this could be normal. So in this case, we have two different things potentially going on. So again, brown is old. That could be a result of implantation bleeding. So implantation bleeding is when that fertilized egg attaches into the uterine wall, right? So when that happens, you can get a little bit of spotting. You can also get spotting from a subchorionic hemorrhage, which is a little pooling of blood underneath the placenta. And we have a video on this. We'll link that into the description. So this mom might have had that brown bleeding or that brown spotting from those things, but she indicates she had a pelvic exam. And so pelvic exams include the manipulation of the cervix and other things, which can cause spotting in the form of red bleeding. So it's something to be aware of, that you might actually find that you're having blood from two different sources, which leads to another thing. A lot of people will see some spotting, right? They go to their doctor, maybe they do an ultrasound and a couple different things, and the doctor says, hey, you have a subchorionic hemorrhage. Don't worry about it. It's going to resolve on its own. So you go home and you think everything's good. You have your bleeding for a couple of days, and then all of a sudden it stops. Just like the doctor said, everything's good. Then 3 or 4 days later, you start bleeding again. You cannot assume that that's bleeding from the same cause. And this is a big mistake a lot of moms make. Unfortunately, if you have bleeding a second time or a third time or a 10th time, you need to always contact your healthcare provider, because believe it or not, you could bleed 10 different times for 10 different reasons, as scary as that sounds. And some of them, again, can be completely normal. The baby will be fine. You will be fine. But others require some treatment and intervention to avoid a miscarriage. So you always want to contact your healthcare provider. So we had this one's a little bit further along. So this is like a second trimester. I'm 16 weeks pregnant, and the last time I bled a lot for 1 day. So I went to the hospital. They checked me. They said everything was okay. But since then, I'm bleeding black blood every day or some spotting every day. Please help. So black blood. This is not something we see a lot. It's usually brown. So black is actually kind of like the darkest form of brown. That's old, resolved bleeding. Usually this is not something we have to worry about. And especially since she reported that she did have bleeding and they said everything was okay, and now she's spotting some of this black blood, that's probably an indication that everything is just whatever's left of that old bleed is resolving. For those of you who might have joined us, please feel free to put any of your questions into the chat, okay? We're just answering some of the questions that we've had on our videos. The final bleeding question that we had this week was, we were planning for a baby. 15 days ago, I started bleeding. First, it was very painful. Then suddenly the pain stopped and the bleeding was very light. Now when I go pee, I see a little bit of blood as well. And sometimes I see spotting. Could you explain what is happening? Could I be pregnant? So, this one was very interesting, and there's a couple things that I see here, and I thought that this would be a good one to address last. So, first of all, if you think you're pregnant, you want to try to take a pregnancy test. You can buy the cheapest one you can find here in the US. You can just go to a dollar store. It really doesn't have to be one of the expensive fancy tests. A cheap test will do it. The only reason why I ever recommend some of those fancier tests, like the ones that say pregnant, is because a lot of people get confused by the pink lines on the stick. So sometimes it's easier for somebody to actually see the word pregnant, okay? So what happens is, if you think you're pregnant, you should get tested. In this case, where she's describing pain with bleeding that gets lighter, the concern would be that there had been a miscarriage. And so if there was a miscarriage, the problem with a pee stick is you're still going to test positive. So what the urine test is measuring is human chorionic gonadotropin. It's a substance that is found in our pee and in our blood when we are pregnant. In a healthy pregnancy, in your blood, that number should continue to get bigger and bigger and bigger. In the hospital, when we suspect a miscarriage, we'll oftentimes do the blood test and then ask you to come back a couple days later and test your blood again. That lets us know what's going on. If the numbers are going down, that means, unfortunately, you are having a miscarriage. If the numbers are going up, that means the pregnancy is doing okay. The pee sticks, the urine sticks for pregnancy tests, unfortunately, you can't see a number and you can't see whether it's trending up or down. And just to be clear, if the lines are darker or lighter, that doesn't indicate what your levels are doing at all. Okay, you cannot go by that as your gauge. So if you're having pain and bleeding, you definitely want to get checked out. Now, the other thing that's mentioned in this question is that afterwards she noticed spotting with peeing. So you can actually spot while having a urinary tract infection. And she does not mention what the pain was like. So it's possible that pain was also associated with a urinary tract infection. Or even more importantly, she might have had a kidney stone. So one of the things that's very common during pregnancy, and just common in general for women, is urinary tract infections. Urinary tract infections are where the bladder gets full of bacteria and you get this infection, right? So for women, we have a very short urethra, okay? That's the little tube that comes out near the vagina and goes up to your bladder, which is like a little ball. What happens is, because it's so short, if we don't clean ourselves properly, the bacteria from our vagina, which can just be normal bacteria or bacteria from using the bathroom, travels up really easily, and then it's in that bubble. And if we hold our urine or we don't empty our bladder completely, then that bacteria sits in there and it grows an infection. And so one of the things that can happen with that infection is that you can get pain and you can actually have bleeding. Now, if you were to get a kidney infection, the likelihood of bleeding gets even greater. So you have your bladder, and then attached to your bladder is two ureters. And those two ureters are tubes that go up to your kidneys. So what happens is, this bladder full of bacteria, they travel up the ureters into the kidneys. And this absolutely will increase your risk of bleeding. Now, like I mentioned, it could be a kidney stone. So kidney stones form from like different, they're like a crystallization or a stone that's caused usually by stuff in your diet, excess minerals in your diet. So what a lot of stones you can pass. So it kind of moves through, but as it's coming through the ureter or the urethra, it's extremely painful. Even though it's teeny tiny, almost grains of sand, it's very, very painful, and it's jagged. These are stones. So it will tear up the tissue, which causes some of that bleeding and pain. So in this case, these absolutely could be other things that are potentially causing that. So no, it does not mean that you are pregnant. And so I would definitely take a pregnancy test to figure that out. All right, so we're gonna go on to a subchorionic hemorrhage question that we did have. I know we linked it into the chat, which is great, but I want to get to this one and give you kind of preview of what you would see in there. So I'm 6 weeks pregnant. I got my transvaginal ultrasound done yesterday. They found that yolk sac cardiac flicker was not seen. There is evidence of a 0.7 by 0.5 centimeter subchorionic hemorrhage at the time of my examination. My cervical length is 3.2. The right ovary, corpus luteum seen. Left ovary, normal. No free fluid in the pelvis. Can you suggest something? I'm worried. Okay, so there's a lot of information in this question, which will give you guys a little bit of insight into your pregnancy. So what's gone on here is that she has gotten pregnant, and the egg, the fertilized egg, has moved into the uterus, okay? And that egg has gone ahead and attached to the uterine wall. When that happens, a whole bunch of blood vessels form, because this is basically going to be the placenta side, and it attaches into the uterine wall, and the blood vessels that go in there are going to feed the baby nutrients and take away toxins, okay? Now, the yolk sac is that early sign of a baby. It looks just like a hollow ball that we'll see inside the uterus when the baby is very, very small. One of the things I need you guys to understand, at 5 to 6 weeks, it is very common to not see the fetus inside that yolk sac. And definitely we might not see the cardiac flicker. It is an extremely early time in a pregnancy. And if your date is even off by 1 week, we might actually be looking at a 4-week pregnancy. It's extremely challenging to see that. Ultrasound is not a perfect science, despite what you think with the 3D and 4D ultrasounds, okay? So, fine. So that is not something to be concerned about. Now, cervical length, 3.2 centimeters. That is honestly awesome. So let's talk cervix. So you have your uterus, and at the bottom is your cervix. This is the opening from the uterus to the vagina, okay? We want our cervix to be long, thick, and closed, just like this. Now, your cervix has to be able to open. So it's got a slit in it because it has to open for a baby's head to come down, right? So in between here will fill up with mucus. That's your mucus plug. That's the infamous mucus plug that we tell you later on you might see as you're dilating, because as this opens, it falls out, okay? 3.2 centimeters is referring to the length. That's a very good length. It varies for everybody too, guys. So you can't look, if your friend says, oh, I'm 3.2 centimeters, my cervical length is 3.2 centimeters, and you're like, oh my God, my doctor said I'm 1.7, right? That's so short. There are some women who have short cervixes, but if you're 1.7 centimeter length cervix stays 1.7 centimeters until you're 40 weeks pregnant, it's no big deal, okay? So what you need to understand is you can't look at your numbers compared to everybody else's, which brings us to the subchorionic hemorrhage. So she gives us some numbers. What you ultimately need to understand is the earlier you are in your pregnancy, the bigger the subchorionic hemorrhage is. And as the pregnancy goes on, the subchorionic hemorrhage gets smaller because the placenta is getting bigger, okay? So it's almost like the subchorionic hemorrhage stays the same size, but the placenta around it gets bigger, so it's actually like smaller and smaller. So it's really, really important for you guys to understand that the size of a subchorionic hemorrhage can be misleading. The biggest thing you need to worry about is if you're very symptomatic. If you're constantly bleeding over this, that could be an issue. The other thing is if they're telling you it's getting larger, okay? So you can't go by the numbers because, again, it's a percentage of the size of the placenta. Instead, what you need to do is let them do the calculations and tell you it's getting smaller and resolving, or it's getting larger and it's not resolving, okay? So ultimately, I would not be worried by this particular ultrasound. It sounds like everything is pretty normal for your gestational age. Now, does that mean that you're not having a complication? For this person, I would say no, it does not mean that. It just means there's nothing here yet that would cause me to be particularly alarmed. What should be happening is they should give you things to look out for, and they should be following up with you relatively quickly, probably a follow-up ultrasound in a week or two to make sure everything looks like it's going well. The other thing you could request is you could request for them to do that blood test, the serum blood test, to see if your HCG levels are rising or falling, because that would also be a good indication of what's going on. For those of you who are joining us, please feel free to put your questions into the chat. That would be really awesome. Okay, so I'm going to do a question that we got this week on a urinary tract infection. Now, we just talked about urinary tract infections, but of course, the second part of it is treatment. So I'm 1 week pregnant and my infection increased. My doctor prescribed antibiotics because the infection is 40 to 50. What can I do? I'm so worried. So I cannot refer to what 40 to 50 means. So if anybody's wondering and why I don't address that, I'm not sure what that means in this case, but I can address the fact of antibiotics. So antibiotics are medications that are used to kill off bacterial infections, okay? They won't work on viruses, they won't work on funguses, but they do kill bacteria. And as I described, a urinary tract infection is a bacterial infection. The reason why it's so important to treat is because if left untreated, a urinary tract infection can cause miscarriage, stillbirth, and preterm labor. It can also cause a systemic infection called sepsis, which is life-threatening to mom if it travels to the kidneys, okay? So it's very important that we treat this. Now, you guys will read a lot of stuff out on the internet that says you can treat urinary tract infections homeopathically using homemade remedies. I'm going to tell you that's not the case, okay? Once a UTI has been pretty much established, those homeopathic remedies very rarely work. If it does work, it's the exception to the rule. I will tell you, if it's extremely early on, very, very early, if you have any inkling and you really start drinking and drinking and drinking and maybe a little bit of real cranberry juice, which there's some anecdotal evidence it might or might not help, then you have a potential to kind of flush it out before it gets going. Because if you just keep peeing and peeing and peeing, you're eventually going to pee out most of that urine. So that is potentially one thing that you could do. But one of the things you need to understand is once it's been pretty much established that peeing it out is just not going to work anymore. And then a lot of those homeopathic remedies, they may kind of keep things a little bit at bay or slow, but ultimately that bacteria is still there and it's getting stronger and stronger, and it may be harder to treat with an antibiotic. So what I want you guys to do is to take those antibiotics. So there's many antibiotics that you can take safely while you're pregnant. It depends on your profile and what your urine test says, which antibiotic they're going to use. If you're concerned about the antibiotic that has been prescribed to you, you can also talk to your local pharmacist. Pharmacists have specialized training in medication and medicating pregnant women, so they can also help you determine if that medication is safe. Once you choose to take an antibiotic, it's extremely important that you take all of it as prescribed. A lot of women want to take as little medication as possible, and antibiotics are really cool. After a day or two, you start to feel better, right? But the thing is that bacterial infection is still there. And if you don't take all of it, you won't kill off all that bacteria. And in a couple weeks, your bacterial infection is going to come back worse and you're going to need stronger medication. Instead, taking all of the medication as prescribed is going to be better for you overall because it's going to help kill off the infection, okay? So you want to make sure that you take all of the medication exactly as prescribed. So for those of you who are joining us, my name is Dr. Samantha, and I'm the maternity mentor. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live. So if you guys have any questions, please feel free to put them into the chat. So I'm going to answer my next question, which is a question about placenta previa. So in 27 weeks pregnant, and I'm still have a placenta previa. No bleeding until now. I'm doing all my household work, but stopped going on walks for 25 weeks on, and I'm not doing any exercise at all. My question is, do I need to start walking or exercising to continue with household work that I'm doing now? So this is a really good question. So you shouldn't have even necessarily stopped like walking unless your healthcare provider told you to do so. So you don't necessarily have to go onto a strict bed rest if you are like having a placenta previa. The only reason for us to do a strict bed rest is if you are bleeding actively. Okay. So what is a placenta previa? So your placenta, right? It's that organ. It's got blood vessels on this side to help feed the baby and to take out toxins. And it's supposed to sit on the side of your uterus. Okay. It connects there and all those blood vessels are there, right? But what sometimes happens is instead of being on the side, it goes over the cervix. Okay. So when it goes entirely over like this is a complete placenta previa. When it goes like this is marginal or partial, right? And this is like a low-lying placenta. So it's like right there, okay? The nice thing is as your uterus gets bigger, right? It actually gets bigger over time. If the placenta is like kind of sitting right here on the edge, right? It sometimes will migrate and move with the growing uterus, and then your placenta previa resolves. That's awesome. If your placenta previa stays exactly where it is, right? What happens is you're going to have to be monitored very carefully, because once your cervix starts to dilate like this to open, now all of these blood vessels are open and you can start bleeding out. So not only is mom now bleeding out, but the baby is also bleeding out. And this is a medical emergency. So usually for moms who have a complete placenta previa, we can't take the chance that you dilate, not even by a centimeter. So a lot of times we'll proactively do a cesarean section around 32 to 34 weeks of pregnancy. It just depends on the mom and the pregnancy. They're going to monitor you very carefully. And most of these moms we bring into the hospital for continuous monitoring because we want to make sure she's in the hospital in case an emergency cesarean section has to be done. Also, unfortunately, if you have a complete previa or a partial, it's pretty much a guaranteed C-section, okay? There's no way to vaginally deliver if you've got this placenta sitting on top of the cervix. It's just not possible. So now we're going to go on to our next question that we have. So we had a couple questions. Actually, no, I'm going to do a question about drying up milk supply. Okay. So how do I stop my breast milk supply? I'm in excruciating pain. I stopped breastfeeding 2 days ago and my breasts are heavy and painful. So definitely check out our video on drying up milk supply. It's extremely important to check that out because it's got a lot of tips in there. But let me give you a couple things. For starters, cabbage leaves. Cabbage leaves have been used for hundreds of years. In fact, we don't know how far back that they have been used. But something about the chemicals in cabbage helps to dry out your milk supply. So what you can do is you can go to the store and get heads of cabbage and you wash the leaves and keep them in your fridge. And then when you are ready, you put a cold cabbage leaf on each breast. You leave it there for 1 to 2 hours until it's wilted. And then you take it out and put in another one. And you can do that all day long. It's not going to hurt you at all. And those cabbage leaves, the cold helps to reduce stimulation to the breast, which helps reduce your milk supply. Plus, you have that cabbage chemical kind of there, which really does help. The next thing is you can use peppermint oil deodorant. So peppermint oil can interfere with your milk supply. And in fact, some women who like to chew peppermint candies, like real peppermint candies, they can actually reduce their milk supply if they don't realize it. So peppermint deodorant can actually interfere with your milk supply. So it's very homeopathic. The only thing is you need to be careful that the baby doesn't get any on their skin. And then you can ask your healthcare provider about whether you're able to use Benadryl or Sudafed. So these are two over-the-counter allergy medications that are used when you have like congestion. Well, they're designed to dry things up. So they will help to dry up your milk supply, which is fantastic because it's a really quick way to get things done. Now, for some of you, you may be offered something called cabergoline or bromocriptine. This is a medication that can only be prescribed by a doctor, and it's oftentimes given to women by their OBGYNs. So the OBGYN means well. Cabergoline and bromocriptine work really, really good to dry up your milk really fast. And it also helps you feel good. So a lot of women are like, oh my God, that sounds amazing. Why can't I do that? The problem is it does make you feel really good. It basically, part of what it does is it boosts some of the neurotransmitters in your brain that helps reduce, it helps reduce depression, right? But when that comes off, when you're done with it and you cannot stay on it for long, when that comes out of your system, you get this big crash and it can actually increase your risk of postpartum depression. So you want to make sure that you're being very careful with that. And I really don't recommend it when there's so many other homeopathic treatments that you could use. So definitely check out the video for more tips, but that's one of the things that you can do. Okay. So now we're going to get to some formula feeding questions that we had. Well, we had a comment, I don't have enough milk to breastfeed my baby, so I'm going to use formula because he's not gaining weight. And then another viewer who's a regular of mine, Gabriella, she said, can you please talk about formula feeding and how it's okay to do so? Can you also give examples of some responses to tell people when they are shaming you and making you feel guilty for formula feeding? Okay, so formula feeding is fantastic, guys, okay? It's something that I feel very, very strongly about. So I'm a lactation consultant. I'm an international board certified lactation consultant. That's the highest level of lactation education you can get. And as such, I'm clearly a proponent for breastfeeding. And I always have been and I always will be. But breastfeeding isn't for everybody and formula is not evil. And that's one thing that I am very clear about. I feel like anybody who needs my help, I'm going to help. And for every single one of my formula feeding moms, I'm going to support them. I'm like a very, very avid supporter. It is not right to shame anyone for their feeding choice, period. If somebody wants to shame you for how you choose to feed, I would honestly probably walk away. I don't even know what response would be worth that because that's just a person who's probably looking to have a fight. What I would tell you is that there's nothing wrong with it. You can say it for any variety of reasons. You can say you did it for your mental health. You can lie and say you did it because you have breast cancer, make that person feel really bad. And I know that sounds kind of crazy to say those things, but for real, we should not be shaming people. And you don't have to explain your choice to anyone. Okay. Now, why is formula feeding great? Okay, so let's start. Formula feeding can be great because then you might be able to sleep more. You know, breastfeeding babies do require more feeds at night. And eventually it does even out. I'm not trying to say that it doesn't. But formula feeding babies in the beginnings tend to sleep a little bit longer than breastfed babies. And so therefore, the parents will oftentimes be able to get a little bit more sleep. The other thing you might find is that you might find that it's more convenient for you because you can just grab and go stuff. If you're modest and you don't really want to breastfeed in public, you don't have to worry about those things. If you're If you're concerned that you do have a supply issue or you're going back to work, formula is a very safe option. And in today's day and age, we really discount for like supply issues, okay? Breastfeeding supply issues. And I think people think that there's only supply issues because women give up or women don't put in the effort. And I'm here to tell you that that's not the case. For starters, at least here in the US, and I'm sure in other parts of the world, wherever some of my viewers might be, it is very common to see women with breast surgeries. So we have breast augmentations or breast implants. We have breast reductions where you're taking away tissue. We also have breast lifts. We have all sorts of breast issues. We have breast biopsies because now we do a lot of screening for different breast issues. All of these manipulations of breast tissue can interfere with you making milk. So it's very common for these surgeons, these plastic surgeons, to tell you that they're going to do minimally invasive techniques and that it's not going to take a chance of interfering with your breastfeeding at all. Okay, they sell a story that's fantastic, but one of the things you need to know is that that's not always the case. So here's the best example I can give you: a breast implant that's put underneath the breast muscle. So a breast implant underneath the breast muscle, so it's not actually going to interfere with the tissue that's inside your breast. And that's where all your milk ducts are. That's where all the places that are making the milk and filling with milk, that's where they are. So the under the muscle simply pushes that out so you look like you have a bigger breast. But the thing is, some women who have that type of breast implant also have their nipple moved to make the breast look better. Okay. So it's very common for the nipple to be taken because by the time you put in that implant, now the nipple's kind of facing down. So they take it off and they move it up. When you cut off that areola and nipple and move it, you are cutting every single connection to the milk ducts. It's gone. It's cut. Okay. So now our bodies are amazing and they will reattach those ducts. But in the meantime, your body has to do that. And if your body hasn't been able to do all of that by the time that you're ready to breastfeed, you may make tons of milk, but there may be no way to get that milk out. Also, again, if they're inside the breast manipulating stuff, they may be removing ducts, they may be cutting ducts, they may be all doing all sorts of things. And what you need to know is there's no specific number of ducts or glands or anything else for all women. There's no like we all have 100. Every single woman is different. And it doesn't matter the size of your breast, which is in the literature. But I think a lot of people think the more breast, the more glands and ducts and all that good stuff. And that's not the case at all. So when somebody's surgically manipulating, you may not make milk, and thus you may need to use formula. You may not know from the outside, and I'm going to tell you this. I have taken care of 3 women with breast cancer in my life who had babies. They all breastfed. They breastfed from the one breast that they had because they had all had a singular mastectomy, but they couldn't make enough milk on the one breast. Some women are lucky enough to do so, and some women aren't. So they had to supplement with formula, and that's fine. But if you're sitting on a park bench looking at them, you don't know that. So my point in saying all of this is there's multiple reasons, including I just don't want to breastfeed, that is okay. And we should be supporting those women. And I think that you can also say it's personal, okay? Because there are some women who are survivors of rape and sexual abuse that can't breastfeed for trauma reasons. And we don't talk about that much, but it's really easy for us to judge a woman until we've walked in her shoes and we know her story. So, and then for that mom who's giving formula because the baby is not gaining weight, aren't we so lucky to have that option? So good for you, because it's very stressful when your baby's not gaining weight. And let me tell you, just from the wording of that question, she was worried. She felt bad. I wish she didn't. We shouldn't be feeling bad because we need to do this kind of thing, because breastfeeding isn't easy. And for all the moms who end up breastfeeding exclusively, formula feeding moms, you should embrace them and love them, but don't look at it as a failure on your part, because it's all hard. None of it is easy. Okay. And then we had a mom who then was on the pacifier video, and they said, we have a 4-day-old and we've used a pacifier the whole time. You said to wait 3 weeks in the video. Should we just let him cry? Because he will continue to cry until we give it to him. We are feeding every 2 hours over an ounce of breast milk. So I thought that this was a great question because, first of all, the baby might be crying because the baby is not getting enough milk. Now, an ounce every 2 hours sounds great, but that might not be enough milk for the baby. And depending on whether you're giving it in a bottle or you're doing it via the breast is a big deal, because if you're doing it via the breast, the baby may not actually be transferring an ounce every couple hours, and then there might be an issue. Ultimately, if you are planning to breastfeed and the baby is latching well and your milk has come in and you have a full supply, you can start using a pacifier right away. Pacifiers are not evil. In fact, they're recommended by the American Academy of Pediatrics once breastfeeding has been established, which is usually 2 to 3 weeks. If you're a formula feeding mom or you're a breastfeeding mom who's using a bottle, you can start to use a pacifier right away. The only reason for the delay for a latching mother is because sometimes it will interfere with the latch because it is a different suck. But if your baby has been doing well, use a pacifier. Babies love pacifiers. It helps them soothe. They were sucking in your belly. They want to continue that behavior. It soothes them and calms them. And it has been shown to reduce the risk of SIDS. So it's a good thing for your baby during sleep. Okay. Plus, it can sometimes help you guys get some sleep. Our final question of the night was a question about depression. I am a patient with an anxiety disorder and panic attacks. I have been on sertraline for almost a year now, and I take Clonitril 0.25 as needed whenever I'm having a panic attack. I want to plan for a baby, but the fear of these anxiety medications during pregnancy is stopping me from planning for one. Is it safe to take Clonitril and sertraline during pregnancy? So I'm going to say right up front, Clonitril is not a medication that is used here in the United States. However, I went ahead and I did some research, and what I believe Clonitril is equivalent to Klonopin here in the US. So Klonopin is a benzodiazepine. It's used for panic attacks, so it makes sense. It's also used at a 0.25 dose. Klonopin is not safe for pregnancy. It has been shown to cause birth defects. So Klonopin is not something that you could take during your pregnancy. So the nice thing is you're planning your pregnancy right now, which is fantastic, because when you plan a pregnancy ahead of time, you can make really good medication decisions and help plan for a safe and healthy pregnancy. Your healthcare provider can also work with you to come up with strategies for dealing with panic attacks, like some homeopathic remedies such as B6, which is safe for first trimester, and magnesium. Now, sertraline is Zoloft, and sertraline has been used now for decades. It is absolutely safe during pregnancy, including the first trimester. It's an SSRI, so it boosts serotonin. It's a serotonin selective reuptake inhibitor. It boosts up serotonin. And when it boosts up serotonin, it helps treat anxiety and depression. And it's also indicated for panic and OCD. Now, a lot of women don't want to take anything during their pregnancy, and that's kind of indicated here. What I would suggest is that you try to find a provider like myself who's trained to do preconception counseling with you. So during this type of counseling, they can go ahead and give you some of your options and develop a plan of care for you that allows for you to get pregnant without medication. So a lot of women choose to go off their medication to try to get pregnant, and that's great. The most evidence-based treatment at that point is therapy. Getting a good therapist on board can really, really help you out. And then once your pregnancy is past the first trimester, a lot of women feel more comfortable to take a medication. Now, again, sertraline can be used in the first trimester, but In my experience, this gives women a lot of anxiety. So we need to meet a woman where she's at and try to suggest other treatments that are more natural that can help manage anxiety until she feels more comfortable. That being said, the evidence shows that untreated anxiety and depression can lead to a miscarriage. So you want to make sure that when you're talking to that preconception counselor, that you're understanding all your risks and benefits. A lot of women go, but what about a birth defect? So sertraline is not linked with birth defects. What you also need to realize is approximately 2% of people who get pregnant will end up having a birth defect. And that's just nothing that they do wrong. It's a perfect situation, perfect health, perfect everything, and they end up having a birth defect in their pregnancy. Well, sertraline, which treats, anxiety and depression, reduces the risk of having a miscarriage, because untreated anxiety and depression can also lead to birth defects. So, again, for this particular person, you cannot take that Clonitrol from what I've been able to figure out. However, it is not used here in the US. So you would have to check with your local pharmacist or your OBGYN, but sertraline is something that could be taken. So we don't have any more questions. If any of you guys have questions, please put them into the chat. I am Dr. Samantha, the maternity mentor. I really appreciate all of you guys coming. We are here every Monday at 9 p.m. Eastern Standard Time. We try to make sure we answer all of the questions you guys have submitted on Facebook, on Instagram, on Twitter, and on our videos. If you guys make suggestions, comments, we look at them and make sure we try to get them here. We will also answer any of the questions you put into the chat. We have some great videos coming up, and I've actually been holding a comment for a little while. One of our viewers suggested learning more about fetal heart rate. So in the coming weeks, we have a couple videos. We have one on bleeding during pregnancy, so that we can actually talk to you in greater detail about what the colors of blood and amounts of blood, so that you have a clear understanding in a video that you can reference, as well as understanding what to tell your healthcare provider if you're reporting it. We have a video coming up on birth plans. We have a video coming up on fetal heart rate. We also have a video coming up on spitting up versus vomiting. That's a very big topic for a lot of parents. Their babies are spitting up and they assume it's vomiting, and it's very hard to tell the difference. And it is very distressing if you think your baby is vomiting. So we have a video coming up on that. Z, I am located in South Florida. So that's one of the places that that I am from. For those, where are you located while I say goodbye? My name is Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions that you've submitted on the videos. Please follow us on Facebook, Instagram, and Twitter for additional content. Those will be linked in the description. Please make sure to share the channel with your friends and family, and hit the like and subscribe button, because it really, really, really helps us out. I appreciate all of you. Thank you so much for joining me. Bye for now.